Okay, and I'm just going to start my timer just to help keep track. All right, the title of my presentation is Perceptions of Burnout Among Nursing Faculty. It's a qualitative study. My name is Mayantoinette Watson. I am from the University of Southern Mississippi. I'm an assistant professor from the School of Professional Nursing Practice. And the objectives for my presentation is to hopefully share my research with you to gain insight and feedback. And hopefully after everyone's presentation, I encourage any questions that y'all have. So what is burnout? Unfortunately, maybe some of you have experienced burnout or know somebody who has experienced burnout in the workplace. But burnout is a condition caused by unmanaged workplace stress that can lead to symptoms of exhaustion, feelings of negativism, or cynicism regarding one's job, and a decrease in professional efficacy. Burnout among nursing faculty is a growing concern, and in the literature review, we saw a lot of research on quantitative research conducted on nursing faculty burnout, yet there is a limited research on qualitative research exploring perceptions of contributing factors to burnout among nursing faculty, specifically in the US. So burning among nursing faculty is a critical issue that not only affects the well-being of educators, but also impacts the quality of nursing education and can ultimately affect patient care in a negative way. The nursing shortage. So it is expected that by year 2030, 42 out of the 50 states in America will likely experience a nursing shortage. So as nursing faculty work diligently to prepare practice-ready nurses in an effort to address the ongoing nursing shortage, challenges such as incivility and increased workload are leading to burnout and intent to leave. I conducted a recent study in 2023, and it involved 150 nursing faculty in southeastern US. And surprisingly, we found that 94% of that sample study was experiencing burnout. So it's clear from the research that nursing faculty are experiencing burnout, but what we really wanted to explore was what are the contributing factors that are leading to burnout? So our study, we did a qualitative study. We utilized purposive sampling for recruitment. We had semi-structured interviews, and for data analysis, we utilized content analysis and coding. For recruitment, the study was approved by USM's Institutional Review Board, and the recruitment criteria included those participants that were included in the previous study, the quantitative study that I talked about earlier. And so those faculty that flagged out for burnout were measured using the OLBI, which is the Oldenburg Burnout Inventory. So if they scored 35 or higher, then they flagged out for burnout. The participants were full-time faculty working in BSN programs from Southeastern US. And Southeastern US consists of 11 states: Alabama, Florida, Georgia, Kentucky, Mississippi, North Carolina, South Carolina, Tennessee, Maryland, Virginia, and West Virginia. So for the sample size, we targeted about 10 to 15 participants as an appropriate number for qualitative research based on literature done by Cresswell in order to reach saturation. And we were able to get 15 faculty to fully consent to participate. Participants from the previous quantitative study who were flagged for burnout, they received they received a follow-up email asking them to see if they wanted to participate in an interview. And so participants were also provided with information on mental health resources and prompted to contact their employee assistance program as needed. So as you can imagine, it might have been a surprise to take the OLBI and find out that you were experiencing burnout. So we wanted to be able to provide them with some type of mental health resource. The Zoom and phone interviews were conducted with various questions, and the average time of the interviews was approximately 20 minutes. The survey questions included demographics questions. So we asked about age, ethnicity, gender, marital status, location, and then length of employment. And then we had 9 interview questions. So question 1 explored some stressors leading to burnout. Question 2 explored coping strategies to deal with burnout. Question 3, explored their social support system. Question 4, explored mentorship. Question 5, explored inclusion and diversity. Question 6, explored mental health resources. Question 7, explored the nursing faculty shortage. Question 8, explored solutions that they believe would help with burnout. And then question 9, explored the intent to leave nursing academia. So we asked them if they ever thought about leaving nursing academia. So the real results for the demographics: for age, the average age was 45 and the youngest was 29. The oldest was 55. For ethnicity, we had 12 faculty Caucasian. We had 2 that were African American, and we had 1 that was Indian American. For gender, we had 14 female and 1 male. For marital status, we had 13 that were married, 1 living with a partner, 1 that had never been married. And then for location, we had a wide range. We had 2 from Alabama, 1 from Florida, 1 from Georgia, 1 from Kentucky, 1 from Maryland, 3 from Mississippi, 2 from North Carolina, 1 from South Carolina, 2 from Tennessee, and then 1 from West Virginia. And then years of employment, the average years was 8, the least was 1, and then the most was 20. For the results of the interview questions, for stressors included faculty incivility and student to faculty incivility. So we had faculty to faculty incivility and then student to faculty incivility. And so incivility is defined as rude or impolite act or behavior. And when we asked faculty to identify some examples of incivility, they gave us some examples. So when we asked them about faculty to faculty, they said some of the examples were making rude comments about faculty to the students, unwilling to negotiate or compromise, not pulling their workload. And then when we asked them about student to faculty incivility, they said student yelling at faculty in classroom, students questioning and arguing about test questions in a rude manner, and then rude or professional emails. They also included unrealistic workload and lack of support. For coping, they said that they use breaks, self-care, family and friends as support. For social support, they use home support. They also use social support as advice and venting. For inclusion and diversity, 7 of the faculty said that their facility were making improvements towards diversity. And they also had established committees where 8 of the faculty said that their facility had no actions for inclusion and diversity at all. For mentorship, 7 of the faculty said that their facility had adequate mentorship. And then 8 of the faculty said that their facility had inadequate mentorship and lack of enough faculty. For mental health resources, the overall theme said that there was lack of support, that there was more focus on student support rather than faculty support, and that there was no support from the school, but there was mental health support from the university. For faculty shortage, faculty said that some of the reasons were pay, incivility, lack of leadership, and then lack of support, and then increased workload. And then solutions to burnout, they said that decreased workload, increased pay, strong leadership, better work environment, flexibility, and support would help. And then when we asked them if they ever thought about leaving nursing academia, 10 of them said that they have thought about it due to the workload and lack of leadership. And then 5 said that they have not because of their passion for teaching. And also, if they did go back to nursing, there was less flexibility in the shift work. So discussion: decreased workload, mental health support, and financial stability are factors that play an important role in combating burnout. Some programs can look into increasing awareness of their own employee assistance program, increasing education about burnout so that faculty are actually aware of the signs and symptoms of burnout and also know how to use the interventions to prevent burnout. Strategies for improving stability among faculty and students are needed in efforts to combat undesirable and negative work environments that could lead to burnout. So some nursing programs can develop stability task force to help with improving incivility issues. Implementing interventions to support mentorship among nursing faculty can also create a healthy work environment to prevent burnout and improve retention. So nursing programs can develop or improve their own mentorship program. And when they talked about faculty shortage, some things that they could do is actually reach out to maybe other nursing programs and use their faculty as mentors, and even see what has worked for other nursing programs to gain insight as well. So in conclusion, addressing nursing faculty burnout can maintain a strong nursing workforce, advance the nursing profession, help tackle healthcare challenges in the future, and then also ultimately improve patient care. All right, thank you for listening. And then I also included my email address if you have any questions.